This video is going to get us through the respiratory system in lab. We're going to start out by talking about the terms inhalation and exhalation. These terms come up a lot in this section. Inhalation is sometimes also called inspiration. It's the act of breathing in. Breathing in is an active process. You have to contract muscles in order to do that. When you breathe in, ordinarily the air is going to enter through the nostrils and then go to the nasal cavity. From the nasal cavity, we'll go to the pharynx, which normal people call the throat. From there, we'll go to the larynx, which normal people call the voice box. And then from there, we enter the trachea, which is sometimes called the windpipe. The windpipe at the bottom splits into two bronchi, and then that leads us into each lung. And so that's the direction the air is going to move as you're breathing in. Exhalation is the exact opposite. It is also sometimes called expiration. From there, you've got some pictures on page 161 and 162 to teach you some of the anatomy of the respiratory system. Your picture to start with is the upper respiratory system, which is your throat on up. You probably had an upper respiratory infection at some point in your life because normal people just call those colds. But when you have those, you get a stuffy nose and maybe it's runny. Sometimes it can spread to your ears. Your throat may be sore. You might cough or sneeze. But upper respiratory infections, generally speaking, are not life-threatening. They're just a pain in the butt when you have them. This whole section up here is your upper respiratory system. So I'm going to change to my nice little color coding things. So, parts that aren't labeled on my picture that you need to know. The opening to the nose is of course called the nostril. The nostrils lead into the nasal cavity as a whole. These little ridges right through here, they're called turbinates. They help to make the air move in a turbulent fashion, and as a result you can collect more particulate matter out of the air. So essentially they help filter bad stuff out of the air so that it doesn't make it deeper into the body. This little structure right here is an opening that would take you into the middle ear portion, the middle ear cavity. There are some tonsils up here that aren't actually in my picture, but that's okay because they aren't in the picture that's in your lab manual either, so we don't have to worry about that apparently. Now again, you can breathe in through the mouth. When you do that though, the air isn't filtered out as well as it is when you breathe through the nose, and so people who do breathe through the mouth are more frequently going to be getting lower respiratory infections, which we'll come back to in a second. Now the pharynx goes from here, stop being weird clicker, all the way down to here. So if I can finally make my clicker go all the way from there to there, pharynx. The larynx then comes off the front of the pharynx and it contains the vocal cords, which are right there. Then, once we get below that, this is the trachea. It splits into a right main bronchus and then a left main bronchus. And then from there, the tubes just keep splitting over and over again. And eventually we end up at this little structure that's called a terminal bronchiole. And then that ends in what kind of looks like grape clusters. A cluster of grapes is called an alveolar sac, but each individual grape is called an alveolus. A group of them can also be called an alveoli, or not an, but alveoli is the plural for alveolus. And I really don't care which way you say that. You can say alveolus or alveolus. Either way is perfectly fine with me. Starting right here on down, you have the lower respiratory system. I alluded to lower respiratory infections earlier. Those are more life-threatening because they're in the lungs themselves. That would be something like tuberculosis or pneumonia, and people die of those diseases every single year without fail. And so you definitely don't want to get infections in your lower respiratory system. Also, you need to know the diaphragm, which is this muscle that separates the thoracic cavity above from the abdominopelvic cavity down below. So that's your basic anatomy of the respiratory system. Let's see, on the next page in your lab manual, page 162, they kind of repeat some of the same stuff that we just did a second ago, which is why I'm showing you the same picture from just a second ago. But what I want to bring to our attention is this picture running off over here. So I already mentioned we've got terminal bronchioles, which are these small tubes that lead to a cluster of grapes. That cluster of grapes, the plural for that again is alveoli. Each individual one is an alveolus with a US at the end of that. Now, we've got, stop being weird, man. Remember that our whole point here is to pick up oxygen and drop off CO2. That means the pulmonary arteries are what leads to these tubes eventually. Then we pick up oxygen around these bubbles, and then these are eventually going to take us back to the pulmonary veins, and that's labeled in the little picture that you guys have, figure 13.3 on page 162. The only other thing that I probably should mention here, it's a repeat from last week with the heart. You need to remember that all of your labels are kind of backwards when you look at right versus left. This is the person's right lung and this is the person's left lung. Remember, it's not named based on where you see it. It's named based on that person who has that lung. And so that's why those labels seem like they're backwards. Okay, after that, your lab manual starts to talk a little bit about breathing again. Breathing involves those two processes, inhalation and exhalation. Inhalation is an active process. You have to contract several different sets of muscles to help you breathe in. Most notably, that's going to be the diaphragm, which is right here in this picture. When you contract that, what it does is it increases the volume in your thoracic cavity. Anytime you increase the volume, you decrease the pressure. So you've created a negative pressure area, and that's going to allow air to get sucked into that. That's called negative pressure breathing, and that's how all mammals breathe, as far as I know. By contrast, when you breathe out, you don't have to make muscles contract to breathe out. You just relax the muscles you had previously contracted, the diaphragm and some intercostal muscles. And as they relax, they're going to decrease the volume, increase the pressure, and that's going to make you blow air out. Now, you can breathe out in excess of a normal quiet breath. And if you do that, you do get other muscles involved, like your abdominal muscles. But normal quiet breathing, exhalation, is a passive process. Now, one of the things we usually do when we're in lab is we play a little bit with this bell jar apparatus. This is to mimic what's going on with the respiratory system as a whole. So to talk about this little side up over here, this hole up here would be like your nose that you breathe in. This would be the trachea. These would be your bronchi. There's a lung, and there's a lung. This sheet would be the diaphragm. And what I want you to notice is when the diaphragm gets pulled down in your body, that's through muscle contraction. Here it's because this person pulls on it. But notice when it goes down, that's when the lungs inflate. When it goes back up, that's when the lungs deflate. That's exactly how your lungs happen to work too. And so this is a nice little experiment that kind of shows you how that works. So you've got a couple of questions on the bottom of page 163. I'm going to let this GIF run through a couple of times, or you can always rewind back up and do what you need to, but make sure you answer those couple of questions on the bottom of page 163. There are some pictures on page 164 to try to help you understand some of that stuff. And then at the top of page 165, there's a set of questions for letter C. Pause the video and you can get the answers to go along with that. All right. Next up, we have lung capacity measurements. So in the medical profession, there is a device called a spirometer, and that device is usually hooked up to a computer, and then it creates a graph of how much air a person is able to move. We can measure several different things with a spirometer. So if you're just sitting there and you're breathing normally, you do what is called a normal quiet breath. That gets you tidal volume. And for most people, tidal volume ends up being half a liter, or 500 milliliters if you prefer to do it in milliliters. That's regardless of the size of the person, the sex of the person. On average, it's 500 milliliters. You can, however, take a breath in excess of a normal quiet breath. So that air that you breathe in above normal tidal volume, that gets you your inspiratory reserve volume. You can also blow out in excess of a normal quiet breath. That gets you your expiratory reserve volume. And then this little piece is actually really important. We can't measure this very well. At least we can't measure it at all in our lab, but your lungs have to keep some air in it in order to not collapse. That air that stays in them to prevent them from collapsing is called the residual volume. Next, you can also measure a couple of capacities, or you can do the math and add the volumes together to get a couple of different capacities. Let's see, the only capacity that they have put in your lab manual is 2. You've got total lung capacity and vital capacity. Vital capacity is usually what we measure in our lab, and I'll kind of show you how we would have done that. In order for you to measure vital capacity, you take a big, deep breath in, like you want to try to blow a balloon in one breath, and then you blow out as much as you possibly can. That air that you are able to breathe in excess and blow out in excess measures the total amount of exchangeable air that you can exchange with the atmosphere. That's why it's called vital capacity. This is the air that you can exchange in order to stay alive. Total lung capacity is that plus this residual volume that has to stay in there in order to prevent your lungs from collapsing. Now, capacities change very much depending on how old a person is, what sex the person is, do they smoke, do they exercise. There's a bunch of factors that are going to play a role in there, but that's basically what you're able to measure with a spirometer. Now, the spirometer that we usually use in the lab looks like this. You put a little cardboard tube on it and then you blow into it and it tells you how much air you're able to blow in. We, of course, cannot do that because I don't even have my own personal spirometer, although I do have something in my office that I play with every now and again, and I'll kind of link to a video on that for you guys later on. But it just measures vital capacity for us. Okay. So we're still going to practice like we could do the math on a person. So there's two charts on pages 166 and 167. It's even color-coded, pink for girls, blue for boys. We're going to be starting with a man. So it says, what is the predicted vital capacity for a 20-year-old male who is 5'8"? Okay, in order for you to answer this question, you have to know that 5'8" is 68 inches. And so you're going to go along the left-hand side and you're going to find 68 on the graph. Then across the top, you have different ages. Find 20 and then take that down to that 68 inches and you'll see that a 20-year-old 5'8" man has a predicted vital capacity of 4,385. That's 4,385 milliliters. Now, let's say that he blew a vital capacity of 3,800 milliliters. So that means he blew into that device called a spirometer as much as he possibly could, but he could only blow out 3,800 milliliters. In order for you to calculate what his percent of normal would be, what you have to do is, how much did he actually blow, divided by how much was he supposed to blow, which was again 4,385, times 100. And so if you put those numbers into a calculator, what you'll see is this dude is only blowing 86% of what he should be able to for a person of his age and his height. Now, I will tell you, based on past experience with the labs at Tarrant County, most of my students do blow significantly lower values than what the prediction is. I don't know if it's because I've got a lot of smokers in my class or if they don't exercise like they're supposed to, but I will tell you that a lot of my people are batting less than 1,000 if you kind of want to look at it that way. Now, a different example, and this one is going to be a personal one for me, because it is me, and unfortunately that means now you guys know how old I am, but we're going to pretend that you don't for just a little bit. Okay, so I've given you my age and my height. Go to page 166 and tell me what my predicted vital capacity is. So remember, 5 feet is 60 inches, so 5'4", 64 inches. Yes, I'm old and I'm short. You're welcome. Then go over to how old I am, and you will see that my predicted vital capacity is 2802. So that's 2,802 milliliters. Well, when the coronavirus hit, I had to do this activity for a different class with my really super janky spirometer, which is just a really glorified big plastic bag. I've got a video of that if you really want to go watch me measure my vital capacity just so you can see how it did. But I blew a total of 3,200 milliliters, or 3.2 liters if you would prefer. So let's calculate my percent of normal. So it's the actual, which in my case was 3,200 milliliters, divided by my predicted, which I already forgot what that was, 2802, and then times 100. Enter those numbers into your calculator and you will see that I had a percent of normal of 114%. Okay, so there are some questions that come after we were supposed to measure those sorts of things in the lab. So the questions that I normally ask are pertinent to you guys, but since you don't get to do this for yourself, let's use our two examples. Our 20-year-old only blew 86% of his predicted normal, so should he be concerned? He probably should. That means he has a lower lung capacity than he should have at this age. And guess what? It gets worse as you get older. And so that means he's just going to go downhill from here unless he does something to change his ways. That is going to put him more at risk for a whole slew of different issues. And so he should be concerned and he needs to start thinking about working out. Should I be concerned? Well, I was, what did we calculate? 114%, something like that. So should I be concerned? No. Being higher than normal is actually okay. It means I work out all the time and I am keeping myself at a fairly normal rate, and I'm weight, and I'm not I'm not smoking. And so that just means my lungs are healthier than average for a person of my height and my age. So I really don't need to be concerned. In fact, I should go brag to everybody that I meet that I am awesome. Okay. There's a couple of other questions that go along underneath that. First, it starts to talk about emphysema. Emphysema is one of the branches of chronic obstructive pulmonary disease, or COPD. What it does is it prevents the lungs from expelling air like it's supposed to, so it would decrease a person's normal normal vital capacity. They can't exchange as much air. Same situation with asthma. How do you think it would affect their normal vital capacity? It would lower it. They have trouble breathing both in and out as a result of constriction of the smooth muscle around their airways. After that, you have learning to play a wind instrument can strengthen the diaphragm and muscles in the thoracic cavity. So how do you think learning to play a tuba would affect percent of normal vital capacity? It would increase it. So here's where I'm going to give you guys a personal story. This is my son. We were doing a road trip to the Grand Canyon. There's this place in, I think it was New Mexico or Arizona. It's called the Blue Hole. It's this little spring-filled pool that you can dive into off the cliffs. My son was diagnosed with asthma when he was 2 years old. And his asthma was really bad. One time, his doctor had to call an ambulance to get him from the doctor's office to Cook's Children in Fort Worth because his asthma was not responding to treatment at the doctor's office. So that tells you how bad his asthma was. Well, when Brandon, my son, got into high school, he decided to join the swim team. Prior to that, his asthma was so bad, if we were to measure his vital capacity, he would be somewhere around 2.5 to maybe 3 liters if he was lucky. Well, after he was on the swim team for just a year, that first freshman year, he could inflate my whole bag, and my bag could hold 6 liters. And so what that shows you is you can totally change your vital capacity. You just have to work to make it happen. Him being on the swim team meant not only was he getting a good workout for the lungs, but you have to hold your breath, which means you have to take deep breaths so that you can hold your breath for even longer. And so that helped him increase that vital capacity and broaden his shoulders and do a whole slew of other things. Basically, swimming is a fantastic exercise for a number of different reasons. But here I'm telling you it's because it can flat out make your lungs healthier. All right. After that, we start talking about respiration, which your lab manual is actually using that term incorrectly. So your lab manual, like I said here, says that respiration is the process of moving air in and out of the lungs, but that's not true. Instead, the process that moves air in and out of the lungs is actually called ventilation. Like, again, if you've been paying any attention to the news, we put people on ventilators when they have severe COVID because they can't breathe for themselves anymore. We don't put them on respirators. That's just something you put over your face to prevent, well, you from getting COVID to begin with. But so ventilation is breathing. Respiration is really gas is passing through a membrane to get from point A to point B, or you're using that gas up. So I just wanted to kind of give you a heads up, a little bit of an error here in the lab manual. So ventilation, we're coming back to that yet again. What we're talking about this time, though, is how do you control it? So breathing is ordinarily an unconscious process, and it's controlled by the inferiormost part of the brain, which is called the medulla. The medulla stimulates your diaphragm to contract whenever your carbon dioxide levels get to be too high. That is very different from how most people think their breathing gets controlled. Most of my students believe that they breathe because they need more oxygen. And while you do need more oxygen, what I'm telling you is that's not actually what your brain is measuring. Your brain is measuring carbon dioxide levels, and it makes you breathe when your carbon dioxide levels get too high. It just so happens that when your CO2 levels are high and you breathe, you're going to breathe more oxygen in. So it helps you in that regard too, but that's not really what your brain is measuring in order to make you breathe. So that's why I went ahead and underlined and bolded this, because it's very important for you to understand all your brain really cares about is carbon dioxide levels. And that's because carbon dioxide levels play around with your blood's pH, and your brain really hates it when your blood pH varies too much. The normal respiratory rate for an average adult is somewhere between 12 to 18 breaths per minute. Now, on page 169, it tells you to measure your respiratory rate, and here's a problem. You can't really measure your respiratory rate because the second you start thinking about it and counting, you're going to change how quickly you were breathing. Generally, when people start to pay attention to their breathing, they tend to slow it down. That's something you can notice if you've ever taken a yoga class. They always tell you, when you start drifting your mind away, come back to your breathing, and you'll notice it slows down during that process. But here's what I'm going to recommend that you do. Find a partner, somebody that you have that's in your little family while you're holed up at home, and you measure their respiratory rate and you explain how to measure yours. So they're going to actually measure your respiratory rate. All you do is you watch your the person's chest rise and fall, and you count how often it does that for 60 seconds, and that gets you the respiratory rate. Now, a more accurate way to do this is actually the way nurses do it. So in last week's class, I told you guys about pulse oxes, and I mentioned that pulse oximeters measure pulse. That means doctors and nurses don't actually have to measure your pulse, and yet they still grab your wrist and act like they're measuring your pulse. What they're actually doing, though, is measuring your respiratory rate without telling you, because if they told you, you could change your respiratory rate. So do that same thing. When you're working with your partner, do the pulse for 15 seconds or whatever, and then measure the respiratory rate accurately. And that way, y'all aren't thinking about it, and so you're not trying to actively control your respiratory rate, since you can consciously control it. All right, after that, a couple of questions as related to breath holding. So first thing you're going to do, hold your breath for as long as you can with no prep whatsoever. Just pause the video, hold your breath, see how it goes. Make sure you do record your time. Okay, before we do any of the remaining questions that are on here, it's very important that you heed my warning. It is possible during these next couple of activities that a person might pass out. So if you ever feel lightheaded, sick, dizzy, like you're gonna puke, anything at all feels off in your body, stop, put your head down to get blood flow back to your brain. Also, putting your head down means your head won't fall down, and it way beats having your head fall down, especially if it falls down a long way. So please stop if you start to feel even a little bit iffy on this, because I don't want anybody to hurt themselves as they're doing this. Hyperventilation is the act of breathing faster and deeper than you need to. Now, ordinarily when a person hyperventilates, it's because they're really excited or really anxious about something, and so usually hyperventilation is bad. There are some times, though, when people choose to hyperventilate on purpose, and breath holding is one of those cases. So your lab manual mentions the Guinness Book of World Record for breath holding. That person hyperventilated on purpose prior to that so that they could hold their breath for a longer period of time. There is a sport that's called free diving, where a person on one breath dives as deep into the ocean as they possibly can and then comes back up. They hyperventilate before they do that dive so that they can go down farther and then come back up afterwards. And then the last little piece of evidence that I will give you to support that this should work is when you think about diving, mammals like whales or dolphins or seals or sea lions or something, they don't breathe in before they dive down. They breathe out to flush as much carbon dioxide out of their system as possible before they dive down. That way they can hold their breath for longer and stay down and get more food while they're down there. So what you're going to do after all of that explanation is you're going to intentionally hyperventilate yourself just for 30 seconds. And then you're going to hold your breath for as long as you can and write your time down. Go ahead and pause the video and do that. Okay. Last thing that they want you to do, and this actually starts on the next page, is grab a paper bag, like a paper lunch sack or something, if you have one available. If you don't have a paper bag to breathe into, just skip this section and I'll still explain the rationale behind it. But if you do have like a lunch sack around, go ahead and grab one. Breathe into that paper bag for 1 minute. What that's going to make you do is rebreathe the carbon dioxide that you were breathing out. So it's going to elevate your carbon dioxide levels. Then we want you to try to hold your breath again, keeping in mind that the whole reason people breathe is because their medulla senses high carbon dioxide levels. So you should not be able to hold your breath as long after you breathe into a paper bag first. So go ahead and do this activity for yourself, pause the video, and record your time. All right, hopefully that worked out for everybody. Next, there's a little section that talks about lime water. We're skipping that entirely, don't worry about it, and we're going down to gas transport and exchange. We've already kind of talked about this back in the circulatory system, but oxygen is transported on hemoglobin and red blood cells. Nothing about that changes here. The book does mention a different type of anemia. In the last chapter, I talked, and I think I did it in lecture, not lab, but I mentioned iron deficiency anemia and hemorrhagic anemia. Well, one of the other kinds of anemia is called sickle cell anemia, and this is a genetic condition that affects people of African descent more than it does people from other areas. Because it is a genetic abnormality, they make their hemoglobin, which is a protein that's coded for by the genes, they make that protein incorrectly. And when it unloads oxygen, it deforms the hemoglobin, which deforms the entire red blood cell. So instead of having the normal shape that they're supposed to have, which is like this guy off over here, they sickle like this and they become more rigid. When they're rigid, they don't bend through the capillaries like they're supposed to, and they make clotting more likely to happen. Sickle cell anemia can be fatal for the people who have it because it prevents blood flow to certain areas of the body. And the only way to treat it in the past was with blood transfusions. We basically have to take out their crappy blood and replace it with good blood that doesn't sickle whenever they get a good workout on or something along those lines. Gene therapy is working on curing sickle cell disease, and CRISPR-Cas has been tested to try to cure this. So hopefully this is something that we can eradicate in the next few, because we're getting a lot closer to being able to do that. All right, how is carbon dioxide transported? Well, this one's a loaded question. It's transported in the plasma for the most part, and when it's transported in the plasma, it's transported in a couple of different ways. Some of it just flat out dissolves in the plasma as carbon dioxide. Not very much of it is transported that way, but that is one of the ways. Some of the carbon dioxide gets into blood cells and it gets bound to the hemoglobin to become this right here. You don't have to know the name of that, but some of it binds to the hemoglobin and it gets transported that way. Couple of side notes there. It does not bind to the same thing as oxygen, so it is not competing with oxygen in terms of transport. By far, the most common way that you transport carbon dioxide, though, is not actually as carbon dioxide at all. It's as this guy. This is bicarbonate. Bicarbonate is a buffer in your bloodstream that helps you regulate your blood's pH. And most of your CO2 is carried in the plasma as that bicarbonate ion. Now, another thing that I want to mention, your lab manual does actually have this formula right here, so let me talk about it just really quickly. Whenever carbon dioxide mixes with water, it participates in a chemical reaction and it forms carbonic acid. Now, I mentioned earlier that one of the reasons that your brain dislikes high carbon dioxide level is because it plays around with your blood's pH. Well, that's because the more CO2 you have in your system, the more carbonic acid you're going to have in your system. Which means if you've been holding your breath for a long time, you've been making your blood more acidic, and your brain really hates it when you do that. And so that's why it triggers you to breathe. It's so it can get the pH back up, since it doesn't like being on the more acidic side. Okay, so that answers everything that I wanted to there. They gave you a little chart on page 171 that shows you the partial pressure of the two different respiratory gases, oxygen and carbon dioxide, in several different places, in inhaled air, in exhaled air, in arterial blood, and so on. And you use that chart to answer the next several questions. Here are the answers to all of the questions that relate to that chart. You can pause the video and just make sure you get the answer. The questions continue on page 172. They gave you a little picture that has some parts labeled and then ask you some questions about those. And so here's the answers to those questions. And again, pause the video so you can get that stuff. Page 173, they give you a table where they either tell you the name of a structure and they want you to fill in the function, or they gave you the function and want you to fill in the name of the structure. This is what should go in all of that. So I well, the first one, you're filling in just the function. So there's the function. The other one, This is what would be the structure, and then what comes after the dash is what would be in the function. So I went ahead and put both there. You just need to fill in whichever one is missing. So they gave you hard palate, you fill in the function. They gave you voice box, you fill in larynx is what's missing in your case. And so that's how you fill in that table. Pause the video so you can get it. Then there's some more questions, most of which we have kind of already answered before. So there's all those. Last, critical thinking I'll slow down and talk through with you. How did scientists prove that high levels of carbon dioxide make you take a breath rather than low oxygen levels? There's so many different ways that we have evidence to help support that idea. Your lab manual specifically mentions altitude sickness. When you go up to altitude, there is less oxygen available in the air around you, but you can still flush CO2 out of your system just fine. When you go up to that higher altitude, you still breathe just like you always do because your carbon dioxide levels are totally normal. The problem with that is since there's less oxygen available in the air around you, you actually become hypoxic, which means you don't have enough oxygen in your system. And that's why you start to feel really tired. You tend to get headaches. You tend to get dizzy more often when you're up at altitude. So that's the evidence that your book gave you. I also went ahead and gave you a couple of other examples in that one. Number 2, how would smoking affect the lungs, especially in terms of vital capacity? So smoking lowers your vital capacity. It does that in 2 ways. So these 2 ways are what lead to the 2 main types of chronic obstructive pulmonary disease. And those 2 types are emphysema and chronic bronchitis. Damaging the alveoli and making them more rigid, that's what leads to emphysema. Destroying the cilia, that's what leads to the chronic bronchitis. And both of those 2 things happen at the same time when you smoke, which is why smokers tend to get both of those problems at the same time. Number 3, is vaping as dangerous as smoking cigarettes? Well, here's the problem with that question. Vaping is still relatively new, so it's not like we have decades of data to show us what happens to the lungs long term for anybody who vapes. However, prior to COVID, if you were paying any attention to the news, there were numerous stories about kids that were 18 to 21 that were suddenly having lung failure, and it was because they were vaping. We don't know if they were vaping at high amounts, if their vape, I still don't know what you call those little pods, I don't know, with the fluid inside of them. Maybe there was a contaminant in there. We're not sure why they got so sick so fast and completely destroyed their lungs. So what I will say at this point is they are definitely not healthy. We don't know yet if they're as dangerous as cigarettes, but they are definitely not good for you. Number 4, a young child threatens to hold her breath until she dies or her mother buys her some candy. Will this really work? Here's why I love this question. This was my biggest fear when I gave birth to my child, was everybody's going to think I'm a horrible parent because my kid's going to hold his breath and turn blue, and then they're going to look at me like I'm trying to murder my child. And then here's the thing, they can't. If a kid tries to hold their breath for that long, eventually the medulla is going to make them breathe. The medulla don't play games. And so, yeah, once they pass out, like I said in my jokey little question, just fling them over your shoulder, take them out to the car, and move on with your day. And people will still stare at you, but who cares? All right, number 5. What happens when a person has sleep apnea? Sleep apnea means that you stop breathing while you're asleep. This is far more likely to happen in obese people because it makes their soft palate flabbier, and so it makes it easier for the uvula to flap back against the pharynx, and then that stops them from breathing. It usually reduces the quality of sleep, which not a good quality of sleep means your immune system's not going to function as well. You're going to have a brain fog. There's a lot of things that come about from that. It's not really life-threatening, though. It's just, I don't know, life-ruining. It'll make you miserable when it happens. Number 6, how does the body respond to high elevations with low oxygen levels? So this is kind of one of those questions that I don't really know what they mean. Did they mean like immediately? Did they mean from an evolutionary standpoint? So I kind of answered it immediately. So like if you were to decide you were going to go to the Swiss Alps to go on vacation from here in Texas, well, the Swiss Alps is a mountain range. So you're going to be going to a high place from nearly sea level here where we are in Texas. As a result, you are not adapted for that high altitude where there's low oxygen levels, and so you're going to get altitude sickness. I already kind of mentioned the symptoms that go along with that, but you're going to feel tired all the time. You might turn even a little bit blue, which is called cyanosis, although that's a very severe case of altitude sickness. You're probably going to have headaches for the first couple of days that you're there and just not have the energy to do anything that you want to be able to do. However, the longer that you're there, the more your body starts to fix the problem. Remember, we talked about homeostasis. Well, you have a homeostatic response to low oxygen levels too. What'll happen is your kidneys are going to make a hormone that's abbreviated EPO. That's going to make your bone marrow churn out more red blood cells. And as a result, your what's known as hematocrit is going to go up, which all of that boils down to you're going to make more blood cells, so you're going to be able to transport more oxygen, even though there's less oxygen in the atmosphere. So eventually you're going to feel better. Now, if you wanted to take this question back to an evolutionary standpoint, some of the people that live at high altitudes all the time, like Sherpas, they actually have different hemoglobin from people that live at lower elevations. And so, like, they've chemically changed themselves as a result of where they live. Number 7, how do insects breathe since they don't have lungs? Well, they have a tracheal system. I think we'll talk about this more in lecture. They have all of these little holes called spiracles in their abdomen, and they breathe through those holes in their abdomen, not through their mouth and not into lungs. Those holes lead to these little tubes called tracheal tubes, and those tubes just branch and end next to every single cell in their body, so they breathe through those tubes instead of through their lungs. So that concludes the respiratory system lab. Make sure you take the post-lab quiz.